Dementia. Dementia is a broad term for a decline in cognitive function severe enough to interfere with daily life. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Dementia is not a specific disease but rather a syndrome associated with various diseases and conditions. Alzheimer's disease. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of cases. It is a progressive, neurodegenerative disorder that leads to memory loss, cognitive decline, and personality changes. Cause of Alzheimer's disease. Genetic factor. 1. Family history higher risk if close relatives have the disease. 2. Genetic mutations rare mutation in genes like HAP, S01, and S02 can cause early onset Alzheimer's. Biological factors. Amyloid plaques beta-amyloid protein deposits disrupt cell communication and trigger inflammation. Neurofibrillary tangles abnormal tau protein tangle damage the internal structure and function of brain cells. Brain changes brain shrinks loss of connections neuron. Symptoms. Early stage, memory loss, especially recent events. Difficulty in finding words or names. Trouble with familiar tasks at home or work. Misplacing things. Poor judgment. Mood changes, including increased anxiety or aggression. Middle stage, increased memory loss and confusion. Difficulty recognizing family and friends. Trouble with language, reading, writing, and working with numbers. Repetitive statements or movements. Hallucinations, delusions, and paranoia. Late stage. Severe memory loss and confusion. Inability to communicate. Inability to recognize family members. Needing help with daily activities, including personal care. Difficulty swallowing. Weight loss, seizures, and increased sleeping. Alzheimer's disease was first described in 1906 by Dr. Alois Alzheimer, a German psychiatrist and neurologist. He studied a 51-year-old patient, Auguste Ter, who had memory loss and disorientation. Upon her death, Dr. Alzheimer examined her brain and found abnormal clumps, amyloid plaques, and tangled bundles of fibers, neurofibrillary tangles. These findings became the hallmarks of the disease named after him. First patient. Auguste Ter is often recognized as the first patient diagnosed with Alzheimer's disease. Her symptoms and the subsequent post-mortem brain analysis led to the identification and naming of the disease. Remedy and management. There is currently no cure for Alzheimer's disease, but several treatments can help manage symptoms. Lifestyle and support. Regular physical activity to improve overall health and cognitive function. Cognitive therapies and activities to stimulate the brain. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids. Creating a safe and supportive environment to help with daily tasks. Support groups and counseling for patients and caregivers. Medications. Cholinesterase inhibitors, for example, donepezil, rivastigmine, to improve neurotransmitter levels. Memantine to regulate glutamate activity and improve cognitive function. Antidepressants, antipsychotics, and anti-anxiety medication.
To see more content like this,
Deccan Pics.